I figured.
So yeah, never been accused of not talking enough.
Oh! Holy cow. You have a strong elbow.
Put it right for me.
Ow! That hurt.
When did the dizziness start?
That's a good question. I don't know, it's been off and on, and I notice it more like, so I have like major tightness in the back of my head.
Sure.
A lot of times it feels like this ball of muscle or something, but it makes me feel like my head isn't like stable. And so that's usually when I feel dizzy.
Okay.
So
they're all connected, and I'll explain in a second.
I figured.
So yeah, never been accused of not talking enough. All right. Well, you have a spine that essentially half of it has feeling, and when we get whiplashed, okay, the whole spine gets injured. Well, specifically both sides, the front and back parts of the spine get injured, but we only can feel the back parts of the spine. The front parts of the spine, the disc, the vertebral body on the front doesn't have any feeling, and so what ends up happening is after you have an injury, your body just changes your posture, right? And so your posture changes to put more weight on the less sensitive structures and take as much weight as possible off the sensitive structures, and it goes away, like you said.
Yep.
It went away. Well, you really just went into avoidance. I broke my right leg, and now I just shifted my weight to my left leg, and it went away. Well, you're not putting any weight on it. So we healed in what we call a compensatory or avoidance position. Now, because you're healing with the head forward, now the muscles, everything is much tighter on your neck because you're in the wrong alignment. After whiplash, we've healed crooked. Now we're trying to live our life with everything tight. Now the engine's running at a higher idle. Then you go lift something and something gets injured. Now you pull something because it's already tight. It doesn't stretch very well when it's tight. And so your ability to get injured is easier because of the alignment and mobility that you're in. The dizziness is an interesting one because there's about 1 million things that cause it. You have your eyes, your ears, and your upper neck are the 3 parts of your vestibular apparatus. So, for instance, my eyes tell me if my head's tilted or not. My vision shows me. You also have these things called semicircular canals, hula hoops in your middle ear that have fluid in them, endolymph. And when you move your head around that, the fluid in the hula hoop moves. And so when I tilt my head, even with my eyes closed, my ears are telling my brain that your head's tilted. So the upper neck gets tight because of the posture, because of injury. Your body thought for the last 40 years that you're going to get another whiplash. It thinks a sequel's coming. And maybe it didn't come, which is good, but my point is that your body doesn't believe that. It believes that you're going to have another trauma. So it puts up walls of tightness in anticipation of another injury. That, with the posture, creates inflammation. So there's sensors in your upper neck. For instance, if I tilt my head to the right, there's a sensor up here that tells my brain that the head's tilted. You follow me?
Yep.
And when my head is straight, those sensors then tell my brain the head's straight. If there's inflammation up here, you have false signals to your brain that your head's tilted when your head isn't tilted. You follow me? Right? So your eyes are saying head's not tilted, hula hoops in the middle ear are saying head's not tilted, but because there's inflammation in your neck, the upper neck is saying it's tilted, and now we have a disagreement, now you're dizzy. So it's your brain wants those signals to all be singing the same note. It doesn't want discrepancies between those systems. When we're younger, our brain can handle somebody being sharp or flat in their notes. But now as we get older, our brain wants everybody on the same tune. When you turn your neck, is there pain?
It's more like it can be. If I go past it, it'll start shaking.
Okay.
It's very tight.
Okay. So both ways to the right.
Yeah, but that's about it.
Is it more difficult to the left?
Yes.
More difficult left. And then does it hurt on both sides or just one side when you turn? Is there
It feels about the same. I think it's worse on the left.
Worse on the left. Okay.
Yeah.
I'm going to go super gentle. Can I help you a little sit up? There we go. Take a deep breath. Real gentle. Just try to relax. I got you. Real gentle. Real gentle. I got you. Head back. Exhale. It's okay. I got you. Here we go. Good. Deep breath in. I got you. Head back. I got you. Exhale. It's okay. I'm not going to hurt you. I promise. There you go. Oh, you did good. Yeah. You okay?
Correct. Oh,
yeah. I know. It's okay. We got to work on. There's a resistance in there. Right.
Yes.
So for every area that's overstressed, the adjacent areas are usually underworking. And so when I get those areas that are frozen working, they're going to be a little upset. But we need to kick their butts a little bit, get them working for us.
Mm-hmm.
Nobody would argue with me that the hand is designed to have fingers that bend. Okay? They're knuckles. They're designed to move. You follow me?
Mm-hmm.
And in the same way, the knuckles in your neck are designed to move. I'm not asking them to do something that they're not designed to do. Now, they haven't done it. They don't move. They've been frozen. Your fingers are straight, and you've kept your fingers straight for 40 years, and now Mr. Smarty Pants here is going to bend your fingers. And so we're not going to do it we're going to be really gentle. I'm not going to hurt you. But
I think my atlas is frozen.
Correct, you got it, okay. You know where I'm going.
Yep.
So we have, your life as a human is going to be much better if you have your atlas working. Our life is not good if our main engine took 24 vertebrae, only 2 vertebrae at the top got names, right? And so you're already familiar with the atlas, and the guy right below him is called the axis.
Mm-hmm.
And they do a disproportionate amount of work. They do something like 60% of the work of your neck happens with just the top 2 vertebrae. And so when the upper neck is not working properly, it's very easy to overstress the backup engine, the secondary vertebrae in the neck. Typically C5 is the number one usual suspect that gets injured. Again, this is what pictures would help show us. But when we get whiplashed, it's almost always the lower neck that gets punched in the face, and the upper neck is on the sidelines of the football field watching with popcorn. Oh, that didn't look good.
I thought, because I've had trouble with my ears before, and I thought the dizziness was from positional.
BPV, yeah, the paroxysmal vertigo.
Yes, and then I'm thinking maybe it really wasn't, and it was from my neck.
What can you give me an idea of what makes it occur? What is the most common instigator of it?
When my neck is tight. Like usually it's a stress related.
Mm-hmm.
And
But it's not a mechanical thing like, oh, I was laying down and then right when I stood up I felt it, or I was driving my car and somebody pulled out in front of me and I quickly turned my neck left and then bam, I got dizzy. Do you understand?
Okay, so that's another thing. I knew there was something else too. So what it does,
I can't give you the answer. I want you to tell me.
So because I've had that happen, when I turn really fast, sometimes my head buzzes, which is right at the base of my neck, which is where all these issues are, and then I might feel dizzy. But it's because I'm like stressed, so everything is tight. It's always when it's tight.
Mm-hmm. Okay. There's overlap there, but I have to. I want you to. I can't give you the answers. And if I give you something, you're like, oh yeah, I have that. It's like, well,
right.
I want you to tell me what you're feeling, and then I'll tell you what I interpret for you. So it's like you can have when you come up from laying down, you can have blood pressure, right? So your blood pressure has to increase, and so if you're holding your breath when you go from laying down to upright, people can be transiently dizzy when they go to sit upright, and that's part of it is just even the mechanics of how you sit upright in your circulation. The brain doesn't like a drop in blood pressure. When you turn your neck, that would usually be your upper neck. So if you're sitting and you turn your neck quickly, do you understand? That's going to change the sensors in your neck. And so if it's a quick rotation of your neck that's doing it, it's most likely your neck that's the culprit of it. The crystals in the middle ear usually have to deal with tilting. So if you add on my back and I roll to my left side, and all of a sudden the room starts to go.
Yeah.
Right? You understand?
I've had that too. So that's why I didn't know really. I think it's like a combination of both, maybe.
Okay. And it can still be the neck, but my point is that you have enough stories of what makes it happen, and I can then give you the reason. I notice it happen the most when when I do this maneuver, or when I'm getting in my car as I'm sitting down, at that moment when my butt hits the seat, then I feel dizzy. You understand? And then stuff like that, if you can kind of make a mental note of what makes it happen, But I have enough reason in your upper neck to justify a considerable amount of what you're feeling. And so let's just start with the most common, the most simple, which is the upper neck is the culprit. Let's clean the upper neck out. Let's not allow false signals to get sent from the upper neck. Inflammation up here, lactic acid will send erratic signals, meaning that the brain-body connection is not clear. Like if I sent you a text and every other word was deleted, it wouldn't be understandable. So let's clean up these little channels here. Pretender. You okay? All right. This knot right here is immense. This is a pretty large knot right here. Oh, gentle. There you go. I'm gonna give you the most baby adjustment. Something might not even move. You might even go, that was so
That was it?
gentle. Right. It's okay. We're going this direction. I got you. I got you.
Oh! Holy cow. Okay, that was good.
You did it.
I did it.
We're going this way.
Oh.
Oh, we got it.
Well,
We're done. Did good.
well, the worst part is over.
You're great. We're done. We're done. I'm just gonna massage now. We're doing good. We're doing good. We gotta start cleaning this thing up.
Really, that was like my worst. That
Oh.
I was looking forward to the elbow.
Okay. Well, you're gonna get a lot of elbow now, so you're good. Just gotta get that upper neck moving. It's like a hammer to a nail. You can't massage a nail into a piece of wood, or if you could, it's gonna take forever. And so we can achieve a great change quickly by adjusting you that we can't achieve solely by massaging. And there's a little mark coming out right there at the top.
There is.
Yep, yep. So just trying to clean these centers out. You okay? Okay, you're doing great. Yeah. Okay.
I always thought that was the eustachian tubes, or is it nearer?
The eustachian tube is going to be way deep inside here. So it goes from your middle ear to your nasopharynx. So it goes more from your middle ear to your nose is where the eustachian tube. This is going to be more your lymphatic drainage. So ultimately the lymph drains down your neck. Sternocleidomastoid is the muscle right here. But this is all, there's what we call the posterior cervical chain is a group of lymph nodes back here. So all the sewer pipes, the maxillary, the tonsillar, the frontal sinuses all drain ultimately down your neck.
Okay.
And so when there's tension in here, you're going to have sinus issues, middle ear issues, absolutely, because the tension in the neck prevents drainage. So they're connected, but indirectly. All right, you're doing
We were
great.
down here for our granddaughter's birthday, and I said, well, if you're having problems, why don't we call? Because she's been watching your videos.
I'm so happy. So happy. You're
I know, I love the videos.
I'm so happy you're
So
here.
you don't live here then? So you
We
still-
do now.
Oh, you
We do now, yeah.
We
We
moved here
moved in
so
June.
yeah.
Oh, wonderful. I'm going too easy. Let me know. I'm going to keep going deeper and deeper, but
Oh, this is nothing.
nothing. Okay, all right, I'm learning it. All right, I'm learning it.
Trust me.
Okay.
My son used to call me, he used to say my back was like a turtle, like a shell,
Okay.
because I never felt anything. It was so hard.
All right. Well, I've never been accused of going too easy, so as long as I'll keep going deeper and deeper until you start squirming, and here we go. So this part of the back gets too tight. The lower back, when you're on the ride, gets whiplashed. Essentially, you get sprain your back and the lower back as a result. But we got to unlock all the parts that are tight up here. The bra assists in this tightness. It stands for brace, and so you've been binding up the middle back for many years, and so this part of your back is going to be protected. The area right next door is the one that gets injured, and nobody talks about it. No, we're not allowed to talk about it apparently. We just, there we go. Got to unlock this part of our back. Yeah. Okay.
Are you feeling his elbow?
Yes.
Okay. Don't want you to be disappointed.
It's like riding a wave. I'm trying to ride the wave of your tolerance, try to push you without overwhelming you. It's my goal.
You have a strong elbow.
I do this all day long. He's not going to get tired. He's going to keep. Yeah, right there. I don't like it. I don't like that. We got to clean that up. Children? How many children?
2.
Yeah, these ribs didn't fully go back down on that side.
Yeah.
Right here.
I wondered about that. My first child, after I had him, I felt like my body was not, it didn't feel right to me. But,
Yeah, these ribs stayed elevated over here. They're not on this side. I didn't feel over here. These ribs are all down. These ribs healed down, and right over here. Hello. Hello. they healed in the open position. So everybody had to move out of their normal alignment to make room for the baby. And then postpartum, it's like the body said, I think we'll just stay here. And so,
Right.
well, it's fine for certain things, but the problem is it immobilizes the vertebrae more to have these ribs elevated, and then that leads to
The
lower
bottom.
back and easier injury to the lower back because this area stays tight.
Interesting.
So it's just a team of 24 vertebrae, and this signifies that this area didn't come back to work after the babies were born. It's like, I don't like it. Ooh, yeah, that's all.
So can they go back?
Yeah, more. I mean, 26 is full skeletal maturity, and the easiest time to put them back down is when you're nursing, right? When the babies are being nursed, when everything is still high in progesterone. You know, that was the opportunity that our world failed you in guiding us. Now, it's not impossible, but difficult. You know, it's a slow. Things get better slowly. They get worse slowly when you're after 28. When you're before 28, things get worse quickly and better quickly. It's like you've tasked me with Inception. I hope you realize the gravity of that request. You've tasked me with symptom and posture care. Do you understand the gravity of that request?
Yes.
I will do it, but I don't think people really don't understand what changing posture is probably one of the most difficult things you can. You're changing where you want to be.
Yep.
Right? That's where it defines everything about you. May come define everything's entire existence. Anyway, I love Inception, by the way. Anyway, so may come to define him. Everything about him. Your posture defines everything. It defines where you are, where you're going to be, which vertebrae work, which ones don't work. And so it is a large thing to ask, and this is why nobody does it. It's difficult. So, okay, we just don't do the difficult things. No, you got to understand the process of how is it done. Well, first we have to unlock you. We have to make the spine work as a team, and then we start stretching. It's stretching that made your posture worse, and it's stretching that fixes it. And in order to safely stretch, wherein that we're not just bending where you've been bending, we need to bend where you've not been bending, we have to unlock you.
Right. Yeah, that feels good.
Mm-hmm.
I think that area, both sides are like the worst pain.
These are the roots of the neck. So they're not separate muscles. They're the same muscles that attach up there on the occiput. They make their roots down here in your shoulder blade. So it's not a separate problem. It's the same problem. It's the same.
Exactly.
The other end of the same muscle. The other attachment's up there. The other roots are down here. Doing great. There you go. Just try to open up that neck a little bit.
Ugh.
Okay,
Yeah.
okay, all right. Just seeing where the edge is.
Yeah, back in the day, there were so few chiropractors when I first had whiplash.
Sure.
Like, it was never a thing to go. And I remember going to my doctor, telling him that I had all this pain in my neck, and he gave me a book
Here you go.
on neck pain.
There you go. Here's a book. Here's a book on that.
Here, read it. And I'm like,
Unbelievable. Well,
they were not mainstream then.
Well, my dad describes he's been practicing 40 years. In the 80s when he started, everybody coming in was 65 plus. Yeah, I remember being a kid asking for candy and gum for my dad's patients. That was my thing. I used to walk around to the patients sitting in the waiting room and got candy, got gum, got candy, got gum, and collect it all and go watch a Winnie the Pooh. Anyway, so but they're all. I learned at a young age that almost every woman has some sort of tic tac or PPC bubble gum or caramel. And so anyway, I'd rob them all. And so this one lady, I love her to death. She just passed away last year. But anyway, she was in her late 80s. And, she kept bringing me candy and gum for like the last 30, 40 years,
Aw.
Anyway, so the point is that it wasn't really until maybe closer to the 2000s where we started seeing more people coming in at a younger age. That the technique, the posture of sitting that amplifies all the years that we sit now is
Yeah, with the computers, yep.
Right,
I think
right.
that's been, because that's all I did.
right.
20 years of computer and
shoulders. I know. That's your goals. Your body, again, thinks a sequel's going to happen. It thinks another trauma's. So part of your treatment is to try to talk to your body and say, hey,
Relax.
I'm not going to get whiplashed. It's a...
I know, it's like, it always tenses and I don't even realize it's doing it.
It's okay. That's what I'm saying. It's going to go back to Inception. It's like Leonardo DiCaprio saying, it's my subconscious. I can't talk to it. I can't talk to it. I can't control my subconscious. It's your body believes subconsciously that it needs to stay in a guarded state.
I just wish I had done this sooner, and I knew I would say that.
I understand. It's okay. We're here now. Let's see what we can do. Tidy things up. There you go. You're doing great. Doing great.
Yeah, I'm still getting those twitches in my head.
Okay. Part of this table is surviving being on it. This table doesn't let you round forward. Sometimes people hate my neck, the headpiece. Your headpiece is so stiff. No, the headpiece is holding your head where it belongs.
Right.
And so,
it's not even that. It's more like I thought it would crush my eyes.
Right, I got
Like,
you.
right.
Well,
But
in that will feel that way because your body wants to curl up in a ball, and the table's not letting you. And so part of your treatment today is just surviving being face down. You follow me? Because that's actually holding you in neutral. It's holding you upright, and it's a good stretch for you just to be face down. This table is actually stretching you. This is not nearly. This would be what I would call the abused side. So because your left side is tighter, this will be the side that gets overstressed. But there we go. Sometimes we call it the compensatory side. So this side does extra work because the other side's underworking. Every nerve can be brought closer to its firing point by the environment it's sitting in, by the pressure that the nerve is feeling, and if it reaches a certain threshold, we then become aware of it. And so it's like I was fine, boom, I have pain, right? And that's because nerves are like light switches; they don't have a dimmer setting, and that can be confusing. It's like, well, no, I leaned over to grab something and then bam, I felt it. Well, no, it was everything additively that calculated together, added it together, that then brought it so that one little thing, straw that broke the camel's back, type of thing. It's a difficult thing because the nerves don't really talk to us until they're upset. They're like passive aggressive people in your life. They smile at you and then knife you in the back. They're not nice people.
But yeah, like I do notice it's like I'm always tense. Like I feel it and then I'm like, oh, I know.
You don't realize it was there until until it builds up to a certain level and
I mean, even now, like I'm like.
Sure.
Go
ahead, tilt your head right for me.
Ow! They hurt.
So mean.
So mean. I think that hurt worse than my neck.
All right, go a little easier. Tilt a little bit. Okay, all right, not so hard.
It was loud. It definitely.
It was loud.
There we go. Go ahead and tilt to the left.
Crunch.
All right, lean back for me. Back on your back. Come on, I know. Come on. Come on, this. Come on, I got you. No, okay, all right. More gentle. Okay, it's okay. Not going crazy. Oh. Okay. Well, I'll be 9 for 10. No, come on. All right, don't take you on. All right, good. Let me move it. You push. Get the idea?
Oh yeah.
Is that too much pain?
No.
You push. Okay, well, put it back down. But you get the idea. You want to press the neck into that curve. Okay.
I mean,
Is that too much?
not really.
Okay. All right. Well, then you got to hold it here for about 20 minutes, and then your body will.
Holding it like
No,
this?
no. Just staying on
there.
the stretch. So you press it in, and then the more you do it, the more the neck won't need that pressure to push it into the mold, and then you cast it into the shape. And that's it. It's just time. Sessions of 20 minutes is what it takes to change the ligament laxity on the front. So because we spend a predominant amount of time here, these rubber bands are all stretched out, and the ones in the front have never been stretched. So we're actually got to stretch the fabric on the front and approximate the fabric on the back. Otherwise, when you bring your head back forward, the tight ligaments on the front just keep pulling you forward. If we don't stretch the front part of the spine, there is no permanent change in where your alignment is.
Is it?
Yeah.
It still feels a little stiff, but it feels like it's more. It's not shaking when I turn